Hey, welcome back to AM Northwest. If you have the fear of the dentist or just need a lot of work done on your teeth, there's a way to make it easier both mentally and physically. And here to tell us more, we're happy to welcome from Limelight Dental Sedation, anesthesiologist Dr. Enrique Abreu, along with one of his patients, Keith Briggs. Nice to have you both here. And Dr. Abreu, let's start with you. Explain to me Limelight Dental Sedation.
Limelight Dental Sedation was created for the patients that have a desire to be basically asleep, to have a long dental procedure, to wake up and be pain-free without any of the normal sights, sounds, and smells that they've experienced in the past in dental offices, which frankly makes them really anxious.
Yeah, it really does. A lot of people have anxiety and they avoid going. Who are the perfect candidates for sedation dentistry?
People that have had other types of sedation dentistry, such as pills or tablets or some anesthesia gas that quite wasn't enough for them to have their dental care done. People that need to have long appointments or multiple appointments where we can get that done in one appointment and they can be completely asleep for the entire procedure. We can also take care of kids and adults.
There's a real benefit there that you mentioned, and that is you can get a lot of work done in a shorter visit because you are sedated.
That's right. The dentist can actually work way faster because they're not having to stop and wait. And this type of thing is really helpful for folks because they don't have to take multiple days off of work. They could just do it all in one visit.
All right. Now, Keith, you're a patient. You chose sedation dentistry. Why?
Because it was a lot easier. I had anesthetic doesn't always work well on me, and so it would wear off halfway through, and then it would be difficult for the dentist to do stuff. So I just decided to kind of get multiple things done all at once, as opposed to keep going into the dentist.
And I've heard Dr. Bray talk before that people don't often remember what the procedure was. Was that your story?
That was totally my story. I woke up and I was in the waiting room, and my wife was there, and I drove her nuts by keep asking her the same question and stuff like that. But
is that the only way you drive her nuts?
Yeah, well, yeah. I'm glad she's not here. She would tell you many other ways.
Yeah. But that's got to be the benefit of it. If you don't have any memory of that, then it makes that experience just that much easier.
That's correct. And you have no recall of any part of that. And I'm in the room with the patient the entire time.
I was going to ask, as the anesthesiologist, you're there monitoring them the whole time?
That's correct. Yeah. I don't leave the room for anything. And so they have two medical experts there, so the dentist can totally focus on your mouth and taking care of doing great quality dentistry, and then I can be focused on all the vital signs and making sure the patients stay safe.
How is it as an anesthesiologist? Is it different sedation than what somebody goes through maybe for a minor surgery in a hospital?
It's similar to that. The benefit here is that we don't use anesthesia gas. Everything goes through an IV that goes in their arm or their hand, and thereby we avoid a lot of the problems with gas, which is nausea. And so a lot of patients describe that they went to the hospital, had a procedure, and they were nauseous for hours. And we can avoid that by not using that kind of...
Yeah, that makes sense. Keith, when you woke up, did you have any real discomfort and pain?
No, I felt great.
Yeah.
I woke up, watched the Duck game, and had a great time afterwards.
Did they win?
Yeah, that was the first.
That'll help a lot. And now, so you're often there with the patient the entire time. Do they need to consult with you beforehand?
Yeah, I call the patient a week before and make sure their medical history is complete and any medications they're taking are safe that we're going to mix with the anesthesia. And then I call them the night before to remind them of any last-minute details and not to eat the night before. And yeah.
You're all over it.
Yeah, absolutely. We work with about 30 different dental offices in town.
All right, very good one, folks. So you would like to know more about the Limelight Group, they're happy to take your questions. Give them a call, 503-207-4992. And if you didn't write that down, it's okay. We'll have it on our website at katu.com. Good to see you again.
Thanks for having me, man.
Keith, thanks for sharing the story. I really appreciate that.